Have you ever experienced that nagging stiffness, a feeling that your hips just are not moving as freely as they used to, perhaps after sitting for a while or getting out of bed in the morning? It is a common sensation, but knowing when it is just a passing ache or when it is a signal to consult a healthcare professional is truly important for your comfort and long-term mobility. You should see a doctor for hip stiffness if it is persistent, worsens over time, severely limits your daily activities, or is accompanied by other concerning symptoms like sharp pain, swelling, redness, fever, or unexplained weight loss. These indicators suggest that your hip stiffness might be more than just typical age-related changes or mild overuse and could point to an underlying condition requiring medical evaluation. The underlying reasons for hip stiffness requiring medical attention often involve inflammation, damage to joint structures, or systemic conditions. For example, conditions such as osteoarthritis, which is the wear and tear of cartilage, can cause chronic stiffness and pain. Inflammatory conditions like rheumatoid arthritis can lead to warmth, swelling, and morning stiffness that lasts for more than 30 minutes. Additionally, injuries like a hip fracture, even a minor one, or problems with the soft tissues around the hip, such as bursitis or tendinitis, can also cause persistent stiffness and warrant a medical opinion. Understanding these potential causes helps explain why certain symptoms are red flags. To help your doctor accurately diagnose the issue, you can actively monitor your symptoms before your appointment. Pay close attention to when the stiffness occurs, such as after rest or with activity, how long it lasts, and what makes it better or worse. Note any accompanying symptoms like pain, weakness, clicking sounds, or difficulty bearing weight. It is also helpful to recall if you have had any recent falls, injuries, or changes in your exercise routine or activity levels. Documenting this information can provide valuable clues for a precise diagnosis and effective treatment plan. A key aspect doctors often look for is how the stiffness impacts your functional movement, including your gait or walking pattern. They might observe if you are compensating by limping or changing how you stand and move, which could indicate a more significant issue. Another important consideration is referred pain, where a problem in your lower back, for instance, might actually manifest as stiffness or discomfort in your hip. This is why a comprehensive examination that looks beyond just the hip joint is often necessary to pinpoint the true source of your discomfort. Ultimately, recognizing when hip stiffness crosses the line from a minor annoyance to a medical concern empowers you to take proactive steps for your health. Consulting a doctor early, especially when you notice those persistent or worsening symptoms, allows for timely diagnosis and management, helping you preserve your mobility, reduce pain, and continue enjoying an active and fulfilling life with greater ease and confidence.